Good morning, all. Are you able to hear?
Yes, ma'am.
Okay.
Yes, ma'am.
New song. Today we are starting with history taking first, because history taking is very important part, and it is an art to take history. So we will start with obstetric history taking. Obstetric, as you know, it is mainly related to pregnancy complications. So pregnancy is divided into firstly into three trimesters. First trimester of first 12 weeks, second trimester from 13 to 28 weeks, and third trimester starts from 29 to 30 weeks. Record. So these are the three trimesters, and accordingly they are going to divide the history taking. But basic criteria of history taking will be the same. It starts firstly with patient's full name. Why the name is important? Because by name it's the identification. It's not like that what is there in the name. By name it's the identification mark of us. Then is the age. Age, as we know, the females, they are divided into first 12 years of life, that is childhood, then they enter into puberty, that is then start the first menarche, and after 2 years period. Generally, it starts from 20 years of life up to 40 to 45. And then comes the age of menopause. It starts from maybe 40 to 45 years, and then comes the age post-menopause. So the age is important because for that we have to divide before puberty, that is childhood. Then from puberty 2 years, then is the period of puberty period, that is 20 to 30. Then is the menopause, and then after menopause it is post-menopausal period. So complaints will be related to the age, and so we must know what is the age of the patient. Then comes the address where the patient is staying, the area, the hilly area, or the area of leukemia. So there are different zones. Accordingly, we come to know where is the patient is living. Then comes the occupation. So in occupation, we must know occupation hazards are there. Lot many. Mainly now it's related to IT field. So in IT field, there are different causes. In IT field, the patients suffer. They are continuously on in front of the screen. So mainly they are having backache, they are having wrist problems, arm problems, and they are having along with this IT, they are lot much stress. So stress related issues, obesity, infertility, male, female both, they are more common. So occupation we must know. Then the mobile number for contact to the patient. Then comes the heat complaints. So with pregnancy, as we have discussed, obstetric mainly they are going to deal with pregnancy. So in this will be the history of amenorrhea. Amenorrhea means absence of period, and there you have to mention the duration. Duration of each complaint is duration is very important. Otherwise, we just write the symptoms and we don't mention the duration. It is of no use. So amenorrhea, again this amenorrhea is of two types, primary and secondary. Primary means there are no menses at all. And secondary means there are menses are started and then stopped, that is secondary amenorrhea. So we must know the duration of amenorrhea. It can be 1 month, 2 months, 3 months, up to 9 months. The pregnancy duration is of 9 months, 7 days. That is, we calculate expected date by adding 9 months, 7 days. So amenorrhea duration we must know, and then we have to mention the months. Then there are various symptoms. As we are starting with the symptoms, there are various symptoms. Mainly the nausea, vomiting. It is more during first 3 months of pregnancy. Why there is nausea and vomiting? It is related to hormonal changes which are there during pregnancy. During pregnancy, as you know, or you will come to know, that there are raised level of estrogen and progesterone. Along with this, there is formation of chorionic villi, and this chorionic villi starts producing human chorionic gonadotropin, HCG. And because of these hormonal changes, there are chances of nausea and vomiting. There can be only nausea, or there can be, along with nausea, there will be history of vomiting. So if you are going to take history of vomiting, you must take detailed history of vomiting. That is, since how many days patient is having vomiting. In a day, how many times he is vomiting. Then the color of the vomitor. because different vomitous color gives us different guidelines. So color of vomitous can be, it can be just watery, or it can be just mucus, or it can be yellowish in color if there is acidic in nature, or it can be even the red. So color can be red if blood is coming out, and it can be brownish in color, hematomesis and hemoptysis. So color, you have to ask if it is red in color, fresh red color vomitus, that means the vomiting is coming from esophagus. It can be esophageal varices also. And if the vomitus color is brown, that means it is coming from the stomach. So the blood is mixed with the acid, and so the color of vomitus is brown. So in nausea vomiting, you must ask whether there is only nausea, duration since how many days she is having nauseating feeling. Then secondly, you have to ask if there is vomiting. In vomiting, you have to see how many times vomiting. So frequency of vomiting per day, then color of the vomitus, smell of the vomitus, then whether it contains food particles. So whatever food has been taken immediately, whether it is coming. So detailed history of vomiting is very, very important. By that we will come to know whether patient is dehydrated. Because in first 3 months of period, it is the period of organogenesis also. Organogenesis means quickly organs are developing. So during this, the nutrition, the fluid intake of the patient should be proper. So detailed history of nausea and vomiting is very, very important. Then usually we are mentioned per vaginal bleeding. As you all know that per vaginal bleeding, it is generally it is related to abortion, miscarriage. Okay, for abortion, the history you have to ask in this abortion, there is hemorrhage before the age of viability. Hemorrhage after the age of viability is called as antepartum hemorrhage, whereas hemorrhage before the age of viability, it comes in abortion. So we have to ask history of pervaginal bleeding. Pervaginal bleeding, amount of bleeding, color of bleeding, whether associated pain in abdomen is there or no, you have to ask. So if there is no history of pervaginal bleeding, you must mention negative history also. That is no history of pervaginal bleeding. If there is pervaginal bleeding, then you must mention since how many days patient is bleeding, color of the bleeding, whether it is fresh red color or whether it is dark brown in color. If it is fresh red color, commonly it occurs with threatened abortion. Just a threat of abortion. Abortion will not take place, pregnancy will continue, but just a threat. In that case, there will be fresh red bleeding. Fresh red bleeding will also be there in cases of inevitable abortion. And in cases of missed abortion or in cases of incomplete abortion, it can be fresh red or it can be brown color bleeding. So, bleeding history you must ask since how many days bleeding is taking place, then color of the blood and whether patient is passing clots also. The clots means heavy bleeding and generally the clots are present in preterm abortion, inevitable abortion, incomplete abortion, and there can be pain with pervaginal bleeding in cases of inevitable, incomplete, and complete abortion. So pain in abdomen is also important. Pain in abdomen can be due to miscarriage or vaginal bleeding, or pain in abdomen can be with vomiting. So detailed history along with duration is very, very important. Then comes the history of weakness. Generally during first 3 months of period, there are not many hormones in this. Just I mentioned there is rage, estrogen, progesterone. Patient is exposed to human chorionic gonadotropin. So many ladies during first trimester they feel weakness. There is a weakness, they feel nauseating, they feel more sleepy, and also there are mood changes. Mood changes are also related to the hormonal changes. So patient during first 3 months, they may feel lonely or they may be irritable or there may be they feel like they must cry. So lot many emotional disturbances are there during pregnancy and all these in history, in symptoms, you must take whether there is history of weakness, whether there is history of mood changes, how is the patient's mood, whether normal, excited, there is anxiety, or patient feeling like depression, irritable, or feeling like crying. So this must be taken in detail since how many days and which are the mood changes. Then sometimes there is breathlessness also. If breathlessness depends whether how is the patient prior to pregnancy. If there is weakness or if there is anemia before pregnancy also, patient is more likely to have breathlessness. So history of breathlessness since how many days you must ask, then comes the constipation. Generally with patients with pregnancy, history of constipation is there. This constipation is related to hormonal changes and so also with history of medicines also patient is having constipation. So you must ask whether there is history of constipation for how many days, his passing stool after how many days, color of the stool, whether it is hard stool or soft stool, or whether she is passing stool with pain. If she is having constipation plus she is passing stool with pain, more likely there will be history of fissure, and it is also common during pregnancy. So have you understood all this first thing? That is full name by statistics, and the symptoms will be the same for the first trimester, so also for second trimester, and so also for the third trimester. You understood? Then coming to the next. Along with this, in second trimester, along with this, there will be history of fetal perception of history of fetal movements. This will start coming from about the 16 weeks. It can come in 20 weeks, 22 weeks. It will be different. For primary, it will be late since perception will be his first time exposing to the fetal movement. So quickening, what we call that fetal movement perception, it is term is called as quickening. So quickening, since when it has started, it will come in second trimester. It will come, it will be there during third trimester also. So coming to the next. Again, it is not clear, but no problem. After the patient's personal history, then we are going to ask her menstrual history. If not possible today, I will share it tomorrow. Next comes the menstrual history. Menstrual history you must take in detail. In menstrual history, first comes the age of menarche. Age of menarche means when first period has started. So then you have to mention the duration. Menarche if the menarche was at 12 years and his patient's age is now 26. So then you have to mention that 14 years back first menses are started accordingly. So you have to ask the history of menarche and then you have to ask about the regularity of menses. So in menstrual history, you must ask whether menses are regular or irregular. If they are regular, means cycle is coming after how many days. So then you have to write if the cycle is coming, bleeding is there for 4 days, you must write the cycle regular. Bleeding if it is 4 days and cycles are coming after 30 days, you must write 4/30 days cycle. And then in menstrual history, you must mention the how many pads are soaked daily. By that you come to know the amount of bleeding. Then color of the bleeding, it can be fresh red or it can be brownish in color. Then whether history of passing clots. If patient is passing clots, that means bleeding is excessive and then patient is more likely to have menorrhagia. So you must mention how many pads also whether history of passing clots and then color of the bleeding, whether it is fresh red or brownish, then pads of then smell of the menstrual blood. Sometimes it's foul smelling. If it is foul smelling, it is most likely to be infection likely to be there. So, in menstrual history, you must mention menarche, date of menarche or year of menarche, whether cycles are regular or irregular, how much is the bleeding, so how many pads are soaked daily, color of the blood, fresh red or brown or blackish, whether associated pain in abdomen with menstruation, whether history of passing clots along with pain. Sometimes in menstruation, there is either pain in abdomen or there is backache or pain in legs. There can be migraine also or there can be history of nausea, vomiting during menses also. All this history you must take in detail. If there is no pain, you must mention no history of pain during menses, no history of vomiting during menses, no history of pain in legs during menses. So detailed negative history also you must mention. And in menstrual history then comes I'm not able to take next slide. Then comes the LMP. LMP means first day of last menstrual period. So you have to ask to the patient since how many months there is no menstruation and accordingly if it is 2 months then you have to take first day of last menstrual, that is called as LMP, last menstrual period. And from that first day of last menstrual period, by neglect rule, we calculate expected date of delivery, EDD. So for EDD, there are two formulas. Either from the LMP, you have to add 9 months, 7 days, or what you can do, you can deduct 3 months and just you have to add 7 days. Only thing, if you are calculating from backside, that is during -3 months, then you have to take next year. Have you understood? So if today's date is there, that is if it is 17th August, uh, then you have to calculate expected date of delivery. So then if you are going to deduct 3 months, so it will be from August, 3 months will be July, June, and May. So these 3 months will be there, and so it will be in May. And then in May, you have to add 7 days. So from 17, if you are going to add 7 days, it will be 24th. It will be 24th May 2021. So either you have to add 9 months, 7 days, then you have to calculate months and add 7 days. Or second thing, since lot many years I am saying that students are not able to calculate EBT properly, you can do just minus 3 months. So if it's August now, you have to minus 3 months, it will be July, June, then it will come in May. Only thing in May, you have to add next year. So it will be May 2021. And then from today, 17, you have to add 70. So it will be 24th May 2021. Have you understood? Calculating expected date of delivery, it is by EBD. So from LMP, you have to calculate EBD. This is all about menstrual history. Then comes the obstetric history. So if not today, I will try to share. I'm not able to share. Right? So nextly will be the obstetric history. Obstetric history, history of marriage is must. Since how many years patient is married. So by that history of marriage, you come to know how many years back she is married, and then you have to take the history, contraceptive history also. Whether they were using contraceptive, which contraceptive, it can be male contraceptive that is barrier. If barrier, there is no problem. But if female is using any contraceptive, since how many months she has stopped and which contraceptive, because contraceptive also has got effect on the body in the hormones. So if oral contraceptive, since how many months you have stopped or injectable, then you must know contraceptive, which contraceptive is used, and since how many months contraceptive are stopped. So in obstetric history, first is the how many years back she is married, history of contraceptive, and then comes the GPLA. So G means gravida. Gravida means how many times she is pregnant. If she is pregnant for first time, it will be primary gravida. If she is pregnant for second time, it will be second gravida. Third gravida, right? Nowadays, only one or two child is there, so it can be primary or second, or it can be then third, fourth, onwards. So G means gravida. Then second is P. P means para. How many times patient has delivered? P. And accordingly, para means if she has delivered once, she is pregnant for second time, then it will be G2 means she is pregnant for second time. So G2. P1 means once she has delivered. And L means living issue. How many living issues she is having? L, if she is having one issue or one child, then it will be she is pregnant for second time, so it will be G2. Para means how many times she has delivered, it will be P1, and L will be how many living issues, so it will be L1. If she is having L1 living issue. If she is pregnant for second time, and first she is having twin, means two children, then G will be 2, G2. Para means she has delivered one, and living will be 2. Since she is twin pregnancy, it will be 2. Next, mute yourself, and then comes abortion. So GPLA. So G means how many times she is pregnant. P means how many times she has delivered. Para. Then if L means how many living issues she is having, either male or female, either daughter or son, and then comes the history of abortion. So whether there was any history of abortion, history of miscarriage, that is hemorrhage before the age of viability. And then accordingly, you have to take detailed history. If she has delivered once or twice, then you have to take detailed history, whether it was full term or preterm, when she has delivered, whether it was normal delivery or cesarean section, whether baby was cried immediately after birth and after delivery of the baby, whether placenta was delivered, in how many minutes placenta was delivered, and whether how much bleeding was there after labor, and whether placenta delivered naturally or there was manual removal. This detailed history you have to take it normal delivery, whether episiotomy was given, how was the episiotomy, whether there was breaking of the episiotomy bone, then in during cesarean, how was the discharge, whether it was foul smelling, and with cesarean section, for cesarean section with anesthesia, with anesthesia, is the spinal anesthesia, whether general anesthesia was given, and then whether baby cried immediately after birth or no. If baby is not crying immediately after birth, that means it was an asphyxia. Asphyxia means another or oxygen supply to brain, fetal brain was less. That is called asphyxia in. So then we want to ask whether baby cried immediately after birth or no. How placenta delivered, whether placenta delivered complete. So detailed history we have to take of the delivery. And then if abortion is there, we have to take detailed history of abortion. Then bleeding was started when she was how many months pregnant, whether 1 month, 1 month, 7 days, 2 months, 2.5 months, whether she has terminated pregnancy on her own, then it will be medical termination of pregnancy, and with medical termination of pregnancy, whether it was with tablets or patient has undergone dilatation and cureta. With tablets, whether it was complete abortion or then after tablets, whether patient has to do cureta for the written period. This much history you must ask, because if there is history of cureta, then if placenta is implanted on the same side, there is likely chances of retention of placenta during this pregnancy. And secondly, why we have the history of curita? Because by the curita, there are chances of having Asherman syndrome also. What is Asherman syndrome? Or endometrium is curated, and so then patient will have either adhesions, that is called as Asherman syndrome, or patient can have after curita, patient will have amenorrhea also. So amenorrhea will be due to Asherman syndrome also. So detailed history of abortion, whether it is medical termination or whether it is due to inevitable incomplete abortion, you must all septic abortion you must have, so you must take the history of suicide or termination was done by this tablet and the patient aborted on her own. So detailed history of abortion you must have. So with this, I think the remaining time is 2 minutes. Whether you want to ask queries, you can unmute yourself and you can ask the query. Or tomorrow also we are going to continue the history taking. So with this, you have to take detailed history up to this, that is symptoms, first 6 complaints, their duration. At the end of lecture also students are joining. It should not happen tomorrow. So detailed negative history, symptoms you must write. Then comes the mental history, then comes the obstetric history, contraceptive history, then comes the personal history. In personal history, you must ask habits. In habits, nowadays you must ask the detailed history of habits, which habits, whether history of smoking is there. If smoking history is there, you must ask how many cigars per day. Then you must ask if alcoholism, which alcohol, how many times in a day or in a week, if she is addict to any drugs, then you must ask the full history of drugs also. So this is related to personal history. And then along with this, you must ask the diet history. What is the patient's diet history? The diet, what she is taking, and then you have to mention in detail because diet plays a very, very major role during pregnancy. So this we are going to discuss tomorrow. But diet detail history, how many times she is eating, what